Yamadungarang. I'm Stuart Sutherland. I head up Aboriginal and Torres Strait Islander Health here at ANU Medical School. Before I start, I'd like to introduce myself as a Wiradjuri man belonging to one of the 250 plus nations that are Aboriginal nations in Australia, and welcome you to Ngunnawal country and pay my respects to elders past and present. Within the school I deliver the Aboriginal and Torres Strait Islander Health curriculum, which considers a number of parts, but one I think is most important is we introduce people to Aboriginal culture and to the history of Australia from an Aboriginal viewpoint, not from a Western viewpoint. And for most of our students, they find that fascinating and at times conflicting to what they've learned in the past, but come away from it feeling as if they've learned something that they wouldn't learn anywhere else. Another thing that I'm very proud of is that our graduating students know how to talk to Aboriginal and Torres Strait Islander people and to work with Aboriginal and Torres Strait Islander people from a very grounded point of view. Some of you may know this as being culturally safe or culturally competent. So I hope to see you around campus in 2022.
Hi everyone, my name is Dr. Rosalie Roney and I'm one of the people who teaches in the Bachelor of Health Science program. So welcome! Let me tell you a little bit about what we do, especially the first year subject that welcomes everybody. So people in the Bachelor of Health Science degree can do this program, Health in the 21st Century course, and people from all around the university can enrol in this, but it's specially orchestrated for Bachelor of Health Science students. We look at the biological, social, behavioural and environmental determinants of health in that course. We look at the health technologies. We investigate things going from the stethoscope right up to MRIs and personalised health treatments, but also we give you a platform from which to leap into all the other courses that we teach. And it gives you a really good starting point to understand the intersections between the clinical, the public health arena and the global health arena and health policy and development. So for the rest of the program, every student who does this course will understand all those connections when they're doing all the other subjects. So you won't feel as lost as you might in first year and beyond. The other things that we do in first year include the whole science array, but the one that I teach, right guys, listen carefully, is research methods. Okay, I know you're going to get glazed eyes and you think that's going to be boring, but truly it's really exciting because you learn what it is that we already know, where the gaps are, and how to go about finding out where those gaps are, and then how to actually conduct research. So you will get skills that you can use in medicine, in public health, in health policy, and so on, and you will feel comfortable to even get jobs during semester breaks or in the summer using the skills that you learn in that subject. There is another part that you also learn in second year, and that's global health. And I'm sure for those of you who are pretty aware of what we're just going through, COVID-19, will understand that it's not just an Australian issue that we're contending with. It's a pandemic, it's global, but you learn about the relationships beyond pandemics, beyond infectious disease, but governance issues, connections between countries, lack of connections between countries, and so on. Of course, there's a lot more in the Bachelor of Health Science, but I'll let you discover that with other people in the program. I'm looking forward to meeting all of you. Thanks.
Have you ever wondered how your body works? How and why your heart speeds up during exercise? Do you know that your body cells and systems do interact and communicate? Are you curious about diseases and how different diseases manifest differently? And the concepts behind maybe different management plans? These all and much more exciting concepts are covered in our very stimulating Med-Eng 2001 and Med-Eng 2002, Medical Physiology and Pharmacology and Pathogenesis of Human Diseases courses. Hi, I'm Suzanne Stefan, a lecturer in medical sciences at ANU Medical School, and I do have also a clinical background as a pediatrician. I'm teaching physiology and pathophysiology for the Bachelor of Health Science and for the medical program. In our medical science courses, we navigate the normal physiology and pathophysiology of different body systems, starting at the cellular level, and explore the pharmacology as an application to the main physiological machinery. And as I always say, it's all about physiology. So the pathology and diseases are alteration of physiology. Management plans are mainly to restore physiology. And pharmacology basically augments and or block physiological mechanisms to help patients. So whatever your future health career path would be, a good understanding of physiology is a key. In our courses, we use a wide range of learning tools: workshops, lectures, case-based learning, research, hands-on lab work, infographic presentation, and lots of more interesting and interactive activities. And while we are all thrilled to have our students around on campus interacting in person, we have invested a lot of time and ideas in creating an equivalent learning experience for all of you who would learn remotely. I'm looking forward to meeting all of you in our interesting medical science courses.
Hi everyone, I'm Tempe. I'm one of the careers consultants with ANU Careers, so welcome. I just wanted to tell you a bit about how we contribute to the professional practice course. We're all about embedding career education into courses, because what we want to do is really get to a lot of students. So this is a really good way for us to work with students. So when we work with this professional practice course in health, we really do it in a really interactive way. So it's going to be a lot of fun for you. It's not about, us just preaching to you and talking. We really want it to be really interactive. So what we do is we come in and work with you in your tutes, and we actually work in groups with you to do a number of activities. And that can be around anything from understanding more about yourself, because if you understand more about yourself, you can make more informed career decisions once you've finished uni. And we talk about how you find jobs. What are the career pathways to the sorts of jobs that you're looking at? How do you nail the job application sort of process and the interview processes? So we're on a really practical sort of basis, looking at everything from when you start uni, the sort of things that you should be doing while you're at uni, to how you go about your job search and how you understand what's going on in your job market, right to the practical skills of doing really good interviews and doing really good assessment centres and other recruitment processes. So it's really important that we do that in a really interactive way so that you can practice doing these sort of things. So it'll be a lot of fun. We do it in class. And there's very little of us just talking to you. It's very much about working in groups together and directing you to some online resources we've got as well. So I'd really encourage you to do this course, and we'd really love to work with you. So thanks for the opportunity to talk to you, and I hope to see you at the start of semester. Thanks, everyone.
Hello, my name is David Kramer, and I am the program convener of the Bachelor of Health Science, and I'm also the Associate Dean of Medical Education and Admissions in the ANU Medical School. A few years ago, we decided to launch the Bachelor of Health Science to provide a pathway to recruit really competitive and high-achieving students into the ANU, and through that pathway into the medical school. And part of the reason we did this was to provide students that come through our undergraduate program with a number of skills both in medical science and in understanding health and disease from a biological perspective, but also people who would have skills in health science to understand the determinants of disease and understand probability of developing a disease based on your background, your exposures, and your genetics. In addition, we focus on developing an understanding of the Australian health system, the global health system, to prepare our graduates for later in their career when they are asked to engage in debates of national issues of significance in health, that they're able to draw upon their knowledge that they gained in health science to make really valuable contributions and to lead decision making. And it's this combination of medical science and health science that's unique about our program, and which we think really prepares students for a wide range of careers in health and in clinical practice. Personally, I teach in the Bachelor of Health Science along with Suzanne in the physiology and pathophysiology courses. I'm an immunologist by background, so I'll teach you about the immune system, and I'll also teach you about the gastrointestinal systems. Now, one of the things that I do, and you'll hear me again, is I give an introductory talk at the beginning to each commencing class. And what you're going to see next is the talk that I gave to my students this year. So I'm standing in our TELT for Technology Enhanced Learning and Teaching Studio that we use to develop our online resources. And I've got here a presentation that I made in February. And this will go through a bit about the course structure, but we'll also introduce you to the practical side of our curriculum in the context of what happened last year with the pandemic. So I hope you enjoy it. I hope that you're able to physically come to the ANU Open Day and talk to me and the other members of the academic and professional staff, and that we're able to answer any questions you have. If you have any questions about the program, you can always email the medical school, and we will get back to you and answer your questions. So thank you for your attention. I hope you enjoy this presentation. My name is David Kramer. I'm the program convener for the Bachelor of Health Science. The Bachelor of Health Science program is a 3-year undergraduate program. It consists of 12 core courses. So these are subjects that you'll study across the 3 years. 4 courses from a list of 18 optional ones, and 8 electives. And this is a multidisciplinary approach to teaching you about health science, so that we give foundation knowledge in medical science, population health, social factors that influence health, and which we refer to as determinants of health, and introduce you to health promotion. We'll give you a broad introduction to research methodology, and we'll give you with a framework to understand how health is managed both within Australia and globally. The program is designed in certain streams. The first stream is our health and medical science core subjects. There's a core stream of health science subjects and a core stream of medical science subjects. Then you have a set of listed electives that you can choose from, and then you have our broad electives. In the design of the program, the 3rd year is designed to be flexible, to allow students to pursue study areas that they have particular interest in. So our health core curriculum has 7 units in it. These are our introductory units, Health in the 21st Century and Introduction to Research Methods. Then in 2nd year, we have Health Systems and Policy and Global Health. And in our 3rd year, we have Aboriginal Torres Strait Islander Health, Health Promotion Principles and Practice, and Introduction to Population. Our medical science core is relatively brief, and this includes human biology in the 1st year, molecular and cellular biology, medical physiology and pharmacology in 2nd year, and pathogenesis of human disease in 2nd year. So this is the core. In terms of the listed electives, there are a number of other subjects that you can take within the medical science curriculum, and there's really virtually nothing that you cannot take as a health science student. In our final year, we have a course called Professional Practice in Health Science. And this is a course that's really designed to give you job skills and introduce you to the process of reflective practice as it impacts upon you and your decisions that you might make within your career and within your life. And so we focus on a number of things to get you to understand about yourself and what motivates you, and then try to introduce various career possibilities. This is, outside of being a medical doctor or in addition to being a medical doctor that are open and available to you that you may not have thought about. We also provide you with some practical instruction in how to develop an effective CV, how to answer interview questions, and how to apply for jobs effectively. Right? So if we look at our map of the program, it's pretty much laid out along the lines of our health stream, which includes these units here, our professional practice in third year, our medical science stream, and then our subjects that count towards the degree. In addition to that, the electives in the program. So one of the things about starting university is trying to figure out what sort of elective you want to study. And here, the goal is to consider two competing interests. The first one is about something that you're going to be happy studying. There's a lot of core subjects that you have to study, and a lot of university is you must do these subjects. And the electives are designed to give you academic freedom to explore other areas. And so choosing something that will make you happy will improve your performance in your other subjects because you'll be happy studying something, you'll be learning something that is of interest to you in addition to the core subjects, and that just will make you a happier student. So really reconsider any choice that might make you miserable. The second one is to be strategic. What I refer to here is something that opens up the door to enable you to study something down the track. So if you have a particular interest in psychology or mental health, and you think that there are subjects that are offered by the Research School of Psychology, which occur in the second and third year that you would want to do electives are, you need to go to the Programs and Courses website, look at those courses and see what are listed as the prerequisite courses for that subject. And so what a prerequisite is something that you must have studied and passed in order to be able to enroll, to have permission to enroll in that subject. So it's important if you do have a burning passion to do a complementary stream of study, that you look at what that might require in the future and choose electives that will enable you to do that. The Science Teaching and Learning Center does have course advisors who can help you with some of those decisions. In your first semester, there's no mistake that you can make in taking an elective. The only real mistake is that you choose something that makes you miserable. Being strategic, be happy, talk to Science Central, talk to the advisors there, and from there develop a study plan that will be based on thinking about what you might do in the future. Okay, so I want to just talk briefly about the course and what the course is designed to give you. You know, health practice needs to include perspectives from social, political, and cultural areas. And this is because health problems are complex. They involve humans, they involve human behavior, they involve biological susceptibility and biological determinants, they involve social factors. And in the past, when I've given this talk, I've talked about this in a fairly abstract way. However, this past year has really kind of crystallized some of these things. And so last year when I gave this talk, it was February 17th, and coronavirus was expanding its footprint in Asia, including Australia. And at the time, we were at the university aware of what was going on. The university was printing signs and putting them up on buildings, telling people to, cover their mouth when they sneeze, to wash their hands, even though at the time there were very few cases in Australia. And a year ago, I was saying to the students, this virus is coming, this is going to change our lives. And we were able to have an idea about what the virus was doing because health professionals, and these are people who work in epidemiology and work for the local disease surveillance groups that are found within countries and then globally, the footprint of the World Health Organization, we're able to track the spread of this disease and the number of cases. And the WHO presented a daily report about what was happening in the world in terms of coronavirus. Right? So in our program, you'll be able to understand how this data is collected and then how this data is used. But extending what happened in coronavirus, if we look next, the first things that came out of China when we were looking at COVID, before it was named COVID, was how were the people getting sick? So this is clinical science. So this will be information collected by hospitals and collected by doctors and nursing staff and doing reviews of how many patients had what sort of symptoms, what was the symptom profile and prevalence of symptoms within people who were presenting with this disease. So from this, you're able to develop a case definition, which is quite broad and variable between different individuals. So we'll learn about this sort of thing in pathophysiology in our program. Then very quickly, scientists around the world and scientists in Melbourne were able to sequence the genome of the coronavirus and using tools of what are called bioinformatics, compare the genetic sequence to other viruses. They were able to determine that this most likely originated in a species of bat and was a new, what we call genetic spillover event, when the virus leaves one animal reservoir and then comes into the human population, creating what's called a zoonotic disease. Within our program, you can learn about this sort of stuff through your medical science elective. So if you take genetics and you take some of the other subjects that are offered from the research school biology, you can get information about this. But how this is then applied in terms of epidemiology and studying the emergence of a disease is more in the range of public health and population health, which you could get out of courses like our Intro to Population Health, our research methods in health science, and in a number of other subjects. So shortly after we had the genetic information, we started developing tests. And we used the tools of molecular biology to develop a test that would detect the viral genome through polymerase chain reactions, through diagnostics. Okay, so you'll be introduced to sort of DNA technologies in the molecular and cell biology course, and then if you do the second year genetics course, you'll learn more about this. But in terms of diagnostics and the ability of a test to predict whether someone has disease, terms such as sensitivity of a test, so the ability to detect diseases with low signal, or specificity, meaning that when you get a positive result, it means it's a true positive. These are terms that you will learn about in population health, in research methods, and other of the health subjects. Then, with knowing this is a coronavirus and knowing the symptomology of the disease and knowing what happens from observations in clinical medicine at the bedside of deteriorating patients, we're able to, through research and that, to understand how this all comes together in the progression of disease. So you have a lot of people with COVID get mild disease. They're able to spread the disease, that's bad, but there's subsets of people who develop severe disease and die. And so once we know the pattern of progression of the disease, we can then start to understand what might be targets to either treat the symptoms and provide supportive care, such as mechanical ventilation, or do more targeted disease intervention. So here you'll learn about these techniques in our second year physiology courses. And then in medical science, you might go forward and study infection and immunity. You might study some other subjects that will help you to understand biotechnology and the development of drugs. One of the things that's really happened in COVID is that we have totally done a paradigm shift in how we look at disease. disease surveillance is a key tool in public health. So this means that when somebody has a disease, if the disease is important from a public health perspective, it becomes what's called a notifiable disease. And that means when the disease is detected, that there must be reporting up to another level. So all that information can be synthesized and a report can be produced in respect to the incidence, so the number of new cases of the disease, or the prevalence, how many people have a disease at a given time, of that disease in the population. And that allows you to do trends. So that first set of data from the WHO that I showed you, that's all about disease surveillance. And this allows you to identify areas where the disease is emerging and becoming more of a problem, and areas where the disease is either staying static or in decline. And then this information is very helpful in understanding what sort of interventions that might be done on a more policy or other levels, such as lockdowns or mask wearing. So this all used to be based on, you have a test and then you report it. And now this has been expanded to where we're all carrying around apps. And so here we have the convergence of STEM subjects, engineering, computer science, and mobile technologies now, Bluetooth in particular, that allows the health researchers to get data in real time in order to do contact tracing. So if someone has a case or an exposure now, we have a whole robust set of data, if they have the app on, that potentially will identify contacts and allow for interventions. Right? So this is something that had been theoretical for a while. COVID brought this into the fore. So knowing about disease, knowing about how disease is transmitted, knowing about disease surveillance, the engineering computer scientists need the health scientists to interact with them to say what sort of data is needed and how do we use that data and analyze that data. So the science of epidemiology is central to public health. You'll be introduced to epidemiology in the research methods course. You'll be introduced a bit about spread of disease in pathophysiology. You'll be introduced in a more detailed level to epidemiology in Population Health 3000. Then we have public health. So again, this goes hand in hand with epidemiology. What are mitigation methods? How can we put things into effect? So now we're starting to get into health protection and policy. So our second year policy course, our third year population health course, and everything that underpins all of this lead people to be able to contribute to decisions about what are effective mitigation strategies. So here right now in Australia, Australians are very good, by and large, at following policy. Snap lockdowns that happen across the country, and really the Australian people have complied with this, the New Zealand people have complied with these short-term restrictions on liberty for the benefit of public good. And this public health policy, the understanding the length of time that you need to shut down, understanding that there are primary sites of exposure that are high-risk areas, and doing all these tracings of contacts through the apps, through the knowledge of how this all works, allows health professionals to limit the impact on the population, but to restrict transmission. And these are things that you'll learn about in our degree. Social determinants of health are things that behaviors, cultural practices, individual practices that contribute to the risk of disease. So we'll learn about these in the introduction to health science, in the research methods, population health. And then if you really are interested in these sort of things, you can take electives in anthropology and sociology and try to figure out why certain people behave the way they do. So then we look at what's happening right now. So this is a map of COVID cumulative cases from last week. So last week there was roughly 107 million confirmed cases of COVID. And you can see that there are some areas which are high rates of cases, and where here we are in Australia and New Zealand, there's very few cases. And it's because of effective public health, and it's because of the attitudes of the population to comply with public health directives. We're now looking at coronavirus vaccines. So here we've got new technologies. So here you'll learn about some of these in our pathophysiology and learn about more in, if you go and study some infectious disease stuff, in medical science electives. So we've learned about looking at patients through clinical science. And we know that the hospitalization rates increase dramatically once you hit about 65 years. And that if you have underlying health conditions, and there's a wide range of these which are known, that hospitalizations and ICU admissions and death occur in a higher proportion of people who have these underlying health conditions. So this sort of analysis of data leads into public policy. So here we now have priority groups for vaccination. We're talking about this right now. In the paper today, the ACT is getting its first shipment of vaccine. Priority group, health workers. Well, we need to protect our health workers so that they can continue to provide care. People 80 or older, and then adults 65 to 75 years are in the top 3 priority groups. So the rollout of the vaccine is based on evidence that these are the people who get sick at higher rates, get hospitalized, cost a lot of money to care for, but also who might die. And so understanding the epidemiology leads to good decision-making in terms of scarce resource allocation. So this is health policy, integrating it. So as a health science student, you're going to learn about how this all comes together. And as a graduate of our program, you're not going to go out here and lead these efforts, but you can develop and work in these areas and build your knowledge further and eventually make significant contributions. So lastly, we have health promotion. So these are our ways of communicating to the population and to diverse subgroups within our population health messages that are presented in an appropriate manner so that we have a very focused messaging to Aboriginal and Torres Strait Islander people so that we use language that resonates with those communities and is effective communicating the core message of health. And so in our health promotion course and in our Aboriginal and Torres Strait Islander health course, you'll learn about some of these things. Okay, so that's just I think it's a nice way to present kind of the skill set that we're looking at. Now, the main thing that I want to emphasize in this is that a lot of you are here because this offers a pathway to our Doctor of Medicine and Surgery. But the health outcomes or the learning outcomes of our program are not just about preparing you for medicine. They're about preparing you to work within the health system, which requires working interdisciplinary with teams. So our postgraduate study options from this course at the ANU are, we have the pathway to medicine, we have a vertical double degree with the Masters of Public Health. We are developing a vertical double degree with the Masters of Culture, Health, and Medicine, which will probably be available for you by the time you're in third year. And the Joint Colleges of Sciences has a pathway to enter with advanced standing into the Master of Secondary Teaching at the University of Canberra. There's also preparation for research. ANU is a very research-focused university. And so we have preparation for honors and PhD studies. So I'll talk now about the pathway to medicine, just to introduce this. So the pathway to medicine offers up to 30 places for our high-achieving Bachelor of Health Science students to get an early offer to medicine at the end of their second year. And the selection for this is based on the academic record, which contributes 40%, performance in the medical school interview, and an application statement that contributes 20%. The vertical double degree with the Masters of Public Health is a program that allows you in your third year to study up to 4 courses at the graduate level in the Masters of Public Health in lieu of electives in the Bachelor of Health Science. This allows you to have Commonwealth-supported payment for those courses. The courses count towards your requirements in the Bachelor of Health Science and in the Masters of Public Health. And what you get out of this vertical double degree is essentially you get a year off because you're given an additional 4 credits towards the MPH, and that allows you to have 8 credits when you graduate with the Bachelor of Health Science, and then you do an additional 8 credits in the Masters of Public Health and graduate with 2 degrees in 4 years, where normally it would be a 3+2 program.
Okay, hello everyone. My name's Henry. I'm in 3rd year of health science. I'm from Adelaide, so I came up from Adelaide at the start of 2019, and I've been living on campus at Bright Hall. I guess I had 3 things I've been thinking about that I wanted to say to first year health science students. Those would be to make the most of what ANU has to offer you. I guess if you think about whether it's you're gunning for med or not, like there's 60% of that sort of med pathway that is your experiences in life, what you have done outside of your grades. And yes, your grades are important, study hard, but learn because you want to learn in the material, not because you need to pass the exam. So everything else outside of that is what you have as experience to draw upon in your interviews, in your applications, and will ultimately just make you a more well-rounded student and more well-rounded, I guess, medical student in the future as well, or health professional. So yeah, make the most of what ANU has to offer you. One of the biggest challenges I guess I had with the degree was not knowing where I stood amongst everyone else. I guess our cohort was very fortunate to have a really good culture. Everyone was helping each other out. There's a lot of good communication, but at the same time, it's hard to look around and not know where you stand, how everyone else is doing. But looking back on it, it's probably very easy to say now, but it doesn't matter. Like, you're going to get the grade you're going to get because you put in the work for it and you're doing your personal best. And so it doesn't actually matter what the person next to you is doing, especially when, you know, cumulatively with everything else that they take into consideration, your unique experience through these first 2 years and then beyond is what actually makes the difference.
Hi everyone, I'm Giuseppe. I'm a first year medical student and I got in through the Bachelor of Health Science pathway. I'm Northern Italian, but I'm a Canberra boy. And one thing I would definitely say that helped me out through the degree was that not only are the lecturers really, really good at what they're teaching, like you can tell that they're passionate about their area of expertise, but they are really there to actually help you try and succeed. So always feel free to reach out. It might seem a little scary, but they're really there and they want you to do well. So that's one thing I would definitely recommend. Another would definitely be with the elective choices, the free electives, do what you want and do what you like. Like, for example, I did physics, math, and some programming courses just because I found interest in that. And that way it's like you tend to put more effort in stuff you enjoy. So definitely do electives that you like.
Hi everyone, I'm Manal. I'm a first year medical student. I did a Bachelor of Health Science in 2018, so I graduated last year. I was part of the first cohort and I was living with my family, so I'm from Canberra. So that was good having my family here. And yeah, so I agree with Giuseppe. I think with elective choices, do something you enjoy. I did a lot of chemistry because I enjoyed that, but also I did summer courses, and that's a really good thing you can do as well if you want to, I guess, lessen the load. So if you do a summer course, I did like 3 courses in semester 1 of second year, and that way, you know, I could focus more on those subjects. And I realized that I was doing better at them because I had one less subject to do. So you can do like water science. I did water science as one of my electives. I really enjoyed that, and it's quite different to health. And then I also did, like I said, chemistry. I even did history and stuff like that. So do what you enjoy. And I would say really involve yourself in extracurricular activities and student societies. So I was part of a student society, and that way you can meet a lot of new people. And I think it's important, you know, balancing a work-life balance, maintaining a work-life balance. And yeah, so also I think really reach out to one another. Like David said, it is a competitive degree, but you know, help each other out. I think that will help in the long run. So in medicine, they're really emphasizing collaboration between students, and I think that will get you all really far. So help each other out. And David and Rosalie are super nice. Let them know how you're feeling, reach out for help, don't hesitate. And I think one thing that distinguishes this degree from, let's say, medical science is that you're focusing a lot like on various health, I guess, fields. So you're looking at public health, policy, and all that. So I think it's really good if you know, you might realize while you're doing the degree, you don't want to do medicine anymore. You might want to go into epidemiology or public health policy. So I think it's really good. It opens your options up. So yeah, I think it's a great degree. Have fun doing it. Focus on learning, like Giuseppe said, and yeah, good luck, everyone.
Hi everyone, I'm Sarah. I'm a 3rd year health science student going into medicine next year. So I'm not from Canberra, I'm from regional New South Wales, and I was actually homeschooled by my dad. And I can honestly say coming to the ANU is the best thing that's ever happened to me. It's been very difficult last year with COVID and, you know, many classes, the majority of our classes online, very limited person-to-person contact. But I think one thing that really helped me was making friends in 1st year. And those people are the people you're ultimately going to be reaching out to for support, as well as lecturers. And you really make the opportunity, even though you're online a lot, to try and connect with your other students, because it'll be a really big support throughout the year to be able to speak to them about what's going on and how you're feeling about things. And, you know, elective choices, things like that. So yeah, work hard, have fun, and I'm sure you'll all do fantastically in whatever you do. And keep your options open. If you don't end up getting into medicine, there is so much out there that you could possibly do. So yeah, I wish you all the very best and look forward to seeing you around, hopefully.